Hey everyone, it's Dr. Mitch here with our rehab tech Kyle. Say hi, Kyle.
Hello everybody.
That's Kyle. So we're going to show you a full body treatment. We're going to work on Kyle today. It was just the weekend, so he was having a bunch of fun, and he actually woke up with a little hip pain. He said it worked out as he got going this morning. We also work on some upper body stuff, knees, ankles, the whole thing. So I'm going to check him and adjust him, and you guys can see how that goes. So I'm going to check Kyle as he's sitting here for kind of the standard subluxations that we're looking for on every visit for our patients. So I just do a quick motion scan, and I've adjusted Kyle probably about a dozen times since he's started here. So I have a fairly good idea of what's going on, but he usually has, and was it right hip today that was locked up?
Left hip.
Left hip. Usually I find something here on the right side, which I did. And with his hip, I'm going to check some muscles to see how they're working, because that'll let me know how this spot should be adjusted. So we'll come back to that. Headaches or neck pain? Alright, so Kyle, you're going to stand up here. I'm going to rearrange the table just a little bit. Go ahead and line your back. So this is standard cervical adjustment. Oh, you're taller than I expected. C3. Just going to get him into the position. It's just a gentle little pulse once we get him there. Just like that. Okay. I'll do one on the other side, a little bit lower. Good. Okay. I'm going to check his muscles and how they're firing right now. We use a technique called applied kinesiology. So I test a certain set of muscles, and if we find weakness, that tells me that there might be something going on. Here. So for him, his TFL, or his tensor fasciae lata on the left side, isn't testing strong. So that tells me that there's something going on in his pelvis or his SI joint, and I have a pretty good idea what's going on with him with that just based on our history. So I'm going to adjust that a certain way. This here. And the right side seems okay, but he does have a little something in this hip, and that's somewhat usual for him. So hip adjustments fairly simple. Just use the table and we drop down like that. There's other ways to adjust the hip, and I'm going to do one more. Just let your leg relax here. Okay. Now I'm going to recheck something here. Keep this straight so that's stronger. Okay. So we adjust the hip, check the psoas, test how it's strong. That's super good. Now for this left side, have you lie on this side, buddy. So we're going to adjust his SI joint, and then we're going to recheck and see if that muscle that was weak on this side strengthens. So this isn't for his low back, this is more for this SI joint. Good. Okay, now line your back. Pull this in his hips and his low back. Lift this leg straight up. Good. Same thing here. Fine. So if anything else was going on with his hip, these muscles would potentially be weak, but I think we handled it on that first adjustment. Now for his mid-back, go back to the area that I scanned previously. I'm just going to do a light adjustment there. Okay, now line your back. So now we finished kind of the main stuff in his neck, mid-back, low back, and that left side of his pelvis. Now I'm going to check knees and ankles, because we've been working on that, and that helps him feel better when he's working here. Hold here. So basically I take a strong indicator muscle and I challenge the joint different ways, and if I test out a weakness, that's what I adjust. So for him, on this side, it's just in his knee right here. So his tibia is internally rotated, and the simple way to adjust it is just going like that. So let's check the other side. And Kyle's on what we would call more of a maintenance phase for his care. Try to get him in weekly because he's working really hard. Now his ankle needs a little adjustment here. So we just try to keep him moving. That's our goal. Come on up. So that was an adjustment for our lovely rehab tech, Kyle. Now he's going to be perfect for the rest of the week. But that's what we do with a lot of our patients is we check them, make sure that they're all tuned up and they feel happy and healthy afterwards. So come on in.